Waking up that morning, I think it was just, I was exhausted. I was tired of fighting through not wanting to be alive every second of every day. So I think that morning when I woke up, I just realized that I would rather lose my life and everyone that I love than go to school. And I think at that point, that was when I realized that this is a serious issue and I can't keep going like this.
The CCBHC, the Certified Community Behavioral Health Clinic, is a mecca of services for individuals with substance use and mental health disorders. It is the federal government's demonstration project, is an attempt to see what would happen if we provided all of the needs that we know from our evidence-based practices, from our research, in one place. So we were able to give them medical screening. We were able to give them medical exams and treatment and referrals to a primary care physician. We're serving individuals from very early on all the way up through adulthood and geriatric. It's one thing we're pushing that bar for individuals and for their families, but it also affects the whole community.
Yeah, my struggles with substance use kind of came about kind of blindsided me. It really does feel like there is a whole other part of you that is created and you are at war with this part and it's stronger than you. It wasn't about recreational use, it was just about, I can't get out of bed, I'm hurting so bad. And at that point, you'll do things that you just, you kind of never thought you would, and that's kind of how my journey began into addiction.
My mom was raised at a time where there was a lot of shame and guilt about having parents that had concerns or issues. My mom, because of the trauma that she suffered throughout her childhood, developed a pretty significant mental health disorder. And my dad used alcohol as a way, I think, of coping with what he was dealing with. And they were actually a very stable force in my life. I always knew that I was loved, and I always knew that they believed in me, but I also knew that they had mental health and alcohol use disorder concerns that affected me.
I remember specifically sitting there and I didn't answer one of her questions, and instead I just thought to myself I'm sitting here and I'm getting evaluated for suicidal ideations when my friends are in math class. And I think that's a really weird realization to make, especially in that moment, is that I'm sitting in a therapist's office telling some woman that I've never met that I don't want to be alive anymore. And she is in turn telling me that they can't help me for 3 weeks. So at that point, I think I had kind of given up. My mom definitely hadn't, thank God, but I had. And then I went to Helio. When I first got there, I was evaluated by a nurse. I got a physical, I got my blood drawn, and I got evaluated for meds right there, the first day that I was there. They didn't make me wait. They didn't make me feel like I wasn't an important enough patient to pay attention to right there.
Thankfully, there seems to be a lot of focus and, new education in the field of addiction, treatment. And, it's like night and day. I have friends that are still going through it, and I'm sure there's other places in the world, but this is where I found it.
When I became married and became a mom, my youngest daughter developed a very significant seizure disorder, and I was working in the field of substance use and mental health treatment. And the people that we serve, just observing their hope, their leap of faith, they're willing to live a different life and do things one day at a time, gave me inspiration to help and to work with my daughter. But it was really just learning about the people that we serve and how they are willing to change their lives, as well as looking at my own willingness to examine my own issues as it was affected by my parents' mental health and substance use disorders that brought me to where I am today. And so when I wake up in the middle of the night and I think about the people that we're serving, I think about our colleagues that serve them and the struggles and the conversations and the vulnerability, I'm inspired to live my life, my professional life and my personal life, to serve the mission of Helio Health so that they can get the care that they need.